for me, becoming kind of going through this self-healing and going through burnout and that, I fundamentally changed as a person. And you can see it from my parenting. Like, I think half of the reason people follow me on Instagram is my kids have turned out fine. As a pediatrician, I like to write. I like meeting people, and I like being with people who like lift me up.
Hello, everybody. Josh Rubenstein, Media Director for Kaiser Permanente, Southern California, and this is another KP Candid Conversations. Intimate conversations about important health topics, but really conversations about individuals, why they got into this business of healthcare. We're talking to one pediatrician today who actually went, like so many other doctors across the country, went through this burnout. And in the midst of dealing with her own well-being, a new passion ignited. And now she's repairing the world, quite literally. Are you an amateur meteorologist? Would you call yourself an amateur meteorologist?
No. I mean, honestly, I was giving the talk, and I really am I just think I make people happy, and I'm like irreverent. But I've been in the weeds so much that I know a lot just because I listen to other people. And I now follow a lot of meteorologists just because like I've been interviewed by a lot of people. But yeah, I don't know. I don't like nerd out on it because I like doing things, but I just take the knowledge I need and so I can finish my project, So I'm not one of those, like there's some people who are such in the weeds climate, they read everything. I only want to know what I need to know. But then I know a lot just because I'm in the vortex of all of it. I write papers and stuff like that. Yeah, but I know, and actually I still don't understand El Nino, like, yeah.
I'll help you with the El Nino, La Nina later. But do you actually look at the forecast? How much do you look at it every day?
No, not really. I look at air quality.
Air quality, okay.
Yeah, because it's so funny. I think I'm very good at like filtering. So like for me, it's like, okay, I'm working on decarbonization. I need to do this because the world's gonna, it's gonna get too hot. So, but I'm very good about just saying like, I have this project, let me get done. And so I have so many projects going on and I get caught up on the projects I'm working on kind of thing. Because there's so much, climate's everything, right? So
yeah.
So now I used to do plastics work, but now I'm like just focused on decarbonization and like electrification, divestment, all that stuff.
So let's go back a little. Let's take a couple steps back before we get to your climate work and climate health. Yeah. Why did you want to become a doctor?
Oh, thank you for asking. I am honest. So I decided, you think about a lot of us who went through a traditional path, decided at 17 what I wanted to do. And what did I know at 17, right? I was good at science. I liked people. My mom told me to be a doctor. There was no doctors in my family. And I kind of just went on that path. And it was definitely the right path for me. But I think when I was 17, I didn't have kind of the self-knowledge to know that that was the right thing for me to do. And honestly, like I did well in my science classes. It was more about prestige for me. I wanted to get into an Ivy League medical school because I went to Ivy League. And honestly, my boyfriend was my lab partner and he was definitely focused on getting to medical school. And I was like, well, he's cute. I want to stay with him. And yeah, I mean, honestly, like we were talking about the other day, I mean, I think his GPA came down a little bit when we started dating and mine went up. Because we went to Harvard Med together, and yeah, I got at my, I was so worried about everyone stealing my boyfriend, so I was like, I got to study. So that's it. And then,
what was the path towards where you are now, focusing on climate? I know that you kind of burnt out a little bit and wanted to shift to this focus, right?
Yeah. So, I mean, I think with like a lot of Southern Californians, I'd always cared about the climate. I mean, I grew up, we're probably around the same age, and like in the 80s was a mega drought, right? Remember, I think none of us were flushing the toilet. I think in middle school we're chanting, if it's yellow, let it mellow, So when you grow up in that kind of environment, you always care about the environment, right? So I always had been mindful and had cared about the earth and whatnot. But what brought me to environmental health was, again, I always loved medicine, but I don't think I truly loved it as much as I'm a very different kind of pediatrician than I am. I'm very, it's my calling, it's my passion. But even up to the time I was assistant chief, I think I was just going through the motions. Like I was a good doctor, I had good numbers and everything, and I think my patients liked me, and I tell people I can fake it, you know. So, but and when I burned out, it really was. It seems kind of crazy, but I was one of those. I was like 1 year to assistant chief, and was very good at numbers, right? I was very metric oriented. I got our department, we hit all the metrics, right? We had all these, and everything's numbers, numbers, numbers. And then I burnt out that summer for a lot of different reasons. I think it's hard being a doctor. I think it's hard being a 2 MD couple. I had kids, went on residency, and it's all this stress, right? You always think you're not enough. The system's like kind of making you like, and our system is wonderful. I love Kaiser, and I've been so supported in our organization. But any place you work, right? There's like this hamster wheel, I call it. And then my first year in assistant chief, I started getting tension headaches. I was really stressed, right? Because you're running you're on call for the whole department. No one wants to work after hours. Like no one wants, work all these extra duties, and the system is telling you do this, do that, get this numbers up. And then I almost left medicine that summer because I had, I still, most of us at Kaiser, even if we're middle management or chiefs or assistant chiefs, we still practice. So I had my own practice. And that summer, it was just, I got really sad. And the trigger was that two of my toddlers got cancer. I'd been their doctor for the whole family. They were the youngest. One died that summer. The other one actually made it and had a very rare form of leukemia and actually got a stem cell transplant or whatnot. I don't know why, but it just hit me. I was just sad. It just seemed wrong, and I feel for the oncologists who deal with this all the time. And then I almost left, I think with the stress of being assistant chief, having kids and my own health and middle age back pain and running issues and, all the stuff, right? I was like, I almost threw in the towel and I didn't let anyone know, but it's kind of sad to think that one can train for that long, right? To go, forever, whatever reason you go into medicine and to want to throw in the towel, and so I thought about it. And then I think what happened was I started going to the beach. I was one of those SoCal kids who never really went to the beach. I wasn't a surfer, but grew up here, lived near the beach, but never really appreciated it. And so I started running to the beach. It was at the same time Greta Thunberg and a lot of the youth activists were out in front in climate. I think I kind of was like, and I had heard about plogging. I think I heard about an Oprah or something. And then this is when you jog and pick up trash. It's plogging. It's
Right.
actually a thing, right? So there's a very niche Instagram community, and I got on Instagram. I started blogging, and I just got really happy. And I remember the moment. It was probably bag 50. So I would go early in the morning, run to the beach, pick up some trash, get a bag, and I was counting. I was counting the number of bags of trash because I'm a numbers person, right?
As your analytics. Yeah.
Yeah, 1,000 bags, and like there's something about, and you probably know. I don't know if you're a beach person or do you.
So I'm like you. I've never appreciated the beach until I lived away from the beach. I lived in Manhattan Beach for a year, but I was so busy working away from the beach that I never enjoyed being there.
Yeah, and it's crazy. It's right there, right? Like
Yeah.
so funny was it, and it's really was, and then I honestly, it was the ocean that healed me. It was like going out early in the morning, picking up trash. Your mind slows down, like everything slows down. I started noticing birds. I'd always wanted to be a bird watcher, but never had the quiet, like the solitude or the quiet to do it. And I started noticing details because you kind of like slow your mind to find the plastic on the beach because I was Dr. Plastic Picker, right? And then like you meet all these like interesting people on the beach in the early morning, like the surf rigs that clean the beach. I would see unhoused individuals and see how they're doing. Because like, as a pediatrician, you have a trash grabber, I feel like so powerful. I'm just trying to help, and then you just meet all these lost souls on the beach wandering in the morning, and I got better and I started blogging and writing. And at that moment, I actually started doing more climate training. I went to climate reality training, actually. It's through the Gore group. And I had this aha moment that I wanted to help with the climate crisis, but we had this final project to do. And I realized, I'm like, oh my gosh, I'm a pediatrician. I need to go back. I never left medicine. I got better. I was still kind of doing assistant chief and doing this and doing that. And never really, I think I didn't fully realize how burnout I had been. And in this awakening, I realized, gosh, I really am better. I'm like so fundamentally joyful. But if I want to help with the climate crisis, I need to go back to medicine. And that's when I found the climate and health world, right? And so, that's pretty much it. And I started doing climate work. And I tell people, I brought everything to it. So when I talk about the climate crisis, after being healed, if you heal a physician, and I'm Harvard trained, have done fellowship, I can write academic papers. And so, yeah, it's been crazy, but I've been on fire. Like you could, like I went back to Harvard and gave a grand rounds and they're like, oh, we want you back. I'm like, I don't think you can afford me. But like I published and like I write op-eds, I do media stuff, and I just do what's fun. But I think for physicians, we tend to be want to help the world, and so if I can, and what I do is, it's actually not that hard, which is what I try to tell people. It's not that hard if you know what you want to do and it brings you joy.
I love that. Well, how do you marry, aside from writing papers and giving talks, how do you marry this passion for protecting the environment and treating people?
Oh, that's a good question. So a lot of us who are like in the weeds climate folks, we talk about this intersection, this Venn diagram of like, what brings you joy? What are you good at? And what's the work that needs doing, right? So that it's really hard
Mhm.
to get to that intersection, right? So what are you good at? What brings you joy? And what's the work that needs doing? So I'm laser focused on decarbonization, right? Because climate change is due to fossil fuels. There's lots of things that can, and everyone's path is different. And I think for me, becoming kind of going through this self healing and going through burnout and back, I fundamentally changed as a person. And you can see it from my parenting. Like, I think half of the reason people follow me on Instagram is my kids have turned out fine. So, the doctor's like, your kids don't necessarily turn out great because, like, we're stressed, we're working so much, right? And then my parenting changed about 4 years ago. Like, I just became much more mindful. And honestly, it became very less judgmental because what I've realized is even though I've experienced burnout here at Kaiser, re-emerging from burnout, I realized that we are in the forefront, and I've been, I'm like anyone can get frustrated about things, but I usually have found that we lead. Like, I'll do something and I'll be like, oh, no one's supporting her, and then suddenly someone from our organization is like, oh, you can have a couple thousand for that. I'm like, oh, great, or you can do this, or good job, and I'm just like, and it's just Kaiser, 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 right? And I just am so grateful for all of it, and I'm very linked with people in the country now because I just reach out. I'll just email. We're all linked, right? I'm like, oh, Dr. Ramin, or Executive Vice President. Hello, how are you? And then I get a reply back.
That's great. What would you say is the biggest climate threat to our health?
I would say heat. Yeah, I mean, I'm a little bit biased in that we did the first inaugural Heat and Human Health Summit in San Diego, which is supported by Kaiser, but
Mhm.
heat. And it sounds kind of crazy, but yeah, it gets hot. And then like back in the 2006, I don't remember, think you, if you remember that heat wave, I wasn't in
Yeah.
San Diego at that time, but that kind of preluded what happened last summer is that when it gets hot, um, a lot of people die of cardiac death. I mean, it's simple. It gets hot, and who dies? It's older folks with pre-existing medical conditions who are probably disenfranchised, don't speak English, live in homes without air conditioning. I mean, this if you talk about health equity and social determinants of health, heat 100% affects the most vulnerable. So I think right now, and I'm kind of working in this, we're kind of spearheading a lot of things in San Diego, but we now know heat affects cardiac death, heat affects more kidney failure. I mean, the ramifications, heat drives preterm birth, drives low birth weight. It's not good, asthma.
So when you're dealing with some of these issues, right? If you talk about lung cancer, right?
Mhm,
You can easily point stop smoking. For those that, of course, we know lung cancer can happen to anyone, but
mhm,
people who smoke have a higher instance and a higher
mhm,
probability of getting lung cancer. So
mhm.
we can point to that. Stop smoking. When you say that heat is our biggest issue, we can't turn off the heat. There's not an easy answer. There's not an easy fix.
Yeah.
How do you handle that?
That's a really good question. And then thank you. That's real. And that's like, I mean, that's a really smart question. And not, a lot of people don't get to that point, right? To ask the right
Mhm.
question. And so I know the answer is that I don't have all the answers, but the community has it, right? And you bring
Mm.
everyone together. And that's what the Heat Summit did. Because it was and a lot of it was and I do believe it was a journey that was meant to go through because so much of what I brought to climate work is the skill sets I developed as assistant chief. Like, when you're running a department, right? I know how to form committees, I know how to motivate folks. I know how to get CME credit, all those things we do within the Kaiser, like, a kind of management apparatus, right? And so that's what I brought to the heat work is that I brought people together at a summit. And if you make it fun, you give people good food, you get people CME credit, you think together. And my thing is that what my thought is that it's really workflows, right? Like, yes, we have to work on decarbonization. We have to work on like school electrification and divestment and all this other stuff. So we have to try to avert everything. But no matter what, it's going to get hot. So in my assistant chief hat, I'd worked on vaccine measures. I'd worked in asthma. So I'm very practical. I really, literally, it's like an example is during the last heat wave as a pediatrician, I had been put on the news multiple times, kind of talking about Snapdragon had opened. There was a heat wave. All these kids were fainting. I was on the news, and that kind of like made me realize. And I was working in clinic, and all these kids were coming in for cardiac workups because they'd fainted during the heat. Like, no one understood what heat did to your body, right? And so, as a frontline pediatrician, I was like, this happens to me in peds. What can I do, right? And so we formed a team. We had a bunch of high school students and medical students do a little research project, and it's education. Literally, you can send direct messaging to high-risk kids. This is going to happen. The coaches should cancel practice. So the kids are, you shouldn't be running across country, but then you have to get this knowledge, right? So we did a little research project, and we got a brochure that someone already made. We're going to make it into a smart phrase. We can do targeted text messaging. So there's lots that we can do in our healthcare system. An example is cardiac deaths. You think about it, if like one of the kids, and it came up from the county folks, they said, we always talk about if you're on certain medications, you're more vulnerable to heat, but no one knew which medications, right? No one knew in the country. Like, we talk about it, right? And so I formed a group and they asked that question, what medications put you at risk for heat? They did a nice presentation. And so now we have that presentation. We know anticholinergics, benzos, all this stuff, right? And so we're not at that point yet, but very quickly, as long as I get a team that can grab this, they can send targeted messaging saying, oh, you're on a beta blocker, it's a heat wave, you should drink more, or you should get into air conditioning, And so, but it's about this coordinated response. So my thing is that, yes, we should do it within Kaiser, but let me do it in San Diego first, bring all the major healthcare groups together. And then the nice thing about our system is that we can quickly spread it throughout the country.
What you're describing really is the ultimate strategic thinking, right? Because it's, how do you think about what the big problem is, get the word out about the big problem, and that's the one that's not going to be fixed tomorrow, but it's behavior changing. And what is tactical? What do we need to do tomorrow to keep people safe, physically opening up shelters and letting people know what kind of medication. So it really is kind of the definition of strategic thinking, isn't it?
Yeah. And that's the thing with my assistant chief hat I had on before, like I had worked on vaccine measures, and you think about it, like, just simple things like flu, like, because, Kaiser prevention is in our DNA, right? We sit there, we talk about flu rates and just getting the flu vaccine in, the more you vaccinate, less pressure on our system, right? And people stay healthier. And so my thing is the same thing. Like, I knew, right? I had a friend, I reached out, I leveraged all my connections to make the summit happen. A lot of it was Harvard connections of folks that are in San Diego, happened to be either Kaiser or non-Kaiser. We'd known each other from medical school. And one of my friends who's at UCSD, and he's a Kaiser patient, is one of the most well-known cardiologists in our area. And I reached out to Luis Castellanos. I'm like, Luis, like, this is your lane. It gets hot. People die of cardiac disease. And so when I was like talking about this possibility of a summit, my thing was that, gosh, give me 5,000, give me some money. If I can avert one cardiac death, ICU, that's expensive, right? Like, I was like, no, we already made our money back. Okay. So like for me, and that practical, that's what I love about our system, because we're practitioners, right? We don't have to talk about the theoretical. We get an idea. We know it's the right thing. We got some evidence to back it up. We can implement it quickly. So, and I've been so, and it's been like so gratifying, because I realized that when we are doing all this planning for the summit, it resonated with everyone. Everyone's like, yeah, that makes sense. Yeah, one cardiac death, that's a lot. But think of how many you can avert just by like doing targeted text messaging, or just understanding the problem, identifying the problem first, which we did this summer. And even like linguistically isolated. I heard this in a talk, I said, oh my gosh, that speaks to my heart, right? Because I and Vietnamese, speak Vietnamese. That's my community. I also love languages. And I realized that when you translate material, it has to be not only in their language, but also culturally resonate, right?
Mm,
And so
yeah.
when we talk about heat messaging, it was crazy because it was linguistically isolated populations. And then we were linked very quickly with the tribal community in San Diego. Because if you do climate work, you have to make sure the Native American tribes are out in front. And we worked with I mean, it's so cool. Like I would sit there at Kaiser, I'm like, we need to work with more cultural anthropologists. This cultural anthropologist, Shasta Gogan, popped up, and she got it. She was like, yeah, when you do targeted text messaging, even though Native American tribes usually use English, it's a different culture. It has
Mm.
to be culturally appropriate. And that to me, having worked on health equity and vaccine messaging, I was like, oh, I love this. Because we know, right? You have to understand where people are coming from when you talk to different communities. And you have to make sure these communities are part of of the process, right? Like, and so when I during the summit, looking at the leaders, it was like we didn't have to fake it. You didn't have to like, it was already just this beautiful California hodgepodge of just diversity and beauty, and just it was just natural. We didn't, it was like tribal leaders and you know just it wasn't like, and it was funny, it wasn't like we just all knew each other, and there was no like, yeah, and it was just, yeah, I don't know, it was beautiful. So hopefully it
I
helps
love
someone.
it. I absolutely love it. Dr. Nguyen, your passion and your stewardship of the environment is inspiring. And I'm so happy that you did not burn out completely and came back and almost like a phoenix handling this part of health work. So grateful to you.
Oh, thank you. Yeah, and that's why I mean, honestly, that I can tell you, I love you. You asked me before, like, why'd you go into medicine? I'm like, I don't know, I was 17, following my boyfriend around. If you ask me now, I love being a pediatrician. Like every day is so joyful. And I think I probably went into management because I was like kind of burnt out and wanted something else to do. But now you ask me, I don't want to be taken away from my patients. The most important thing is what I do in the patient room. I'm so grateful for climate work because I wouldn't have noticed these things about my patients if I hadn't been on the beach and had to slow down. And mindfulness, if I can, is so real. And so like I'm noticing you, you're noticing me. We're having a real conversation, right? And I think that if I can, and so if you're burnt out there, I know this is more for our population, like our doctors, like I feel, and like, I mean, you've gone through so much if you're a physician to get where you are. And so please don't give up on yourself, and it's okay to be hurt. And if I can get through burnout, anyone can. And so just know that all of us, no matter what you do out, like doctors and Kaiser and nurses and our project managers, we all are doing the work of good. And sometimes we can sit and fight within like committee meetings and irritate each other, but there is no bad pediatrician. There's no bad doctor. Like we are all superheroes. And it sounds kind of crazy, but if I can really tell you, if people can truly believe that, I've done my job.